Post-operative instructions, dental implants. Pain. The good news is that many patients require very little pain medicine after surgery, and they find the procedure to be less painful than they expected. Please remember that pain medicine can take 30 to 45 minutes to take effect. Therefore, be sure you are planning ahead if you start experiencing any pain. Frequently, a steroid dose pack is prescribed after surgery, and this will reduce inflammation and pain. If you are prescribed a steroid dose pack, we will have you start this the day after surgery because we will have given you one steroid dose through the IV during surgery. Day 5 is a good time to begin ibuprofen, 600 to 800 milligrams, every 6 to 8 hours for the next 2 to 3 days if medically tolerated. Bleeding. Many implant patients report very little bleeding after surgery because the implant will help close off a socket or the gums will be tightly closed around the implant. Please apply firm pressure to the area by biting down on the gauze for a straight 45 minutes without removing the gauze. If bleeding continues, then reapply the gauze with firm pressure. Swelling. Swelling usually peaks about 3 days after surgery. We encourage you to keep your head elevated for 3 to 5 days to reduce swelling. Using the Cool Jaw ice packs are very important and can minimize swelling as well. Care of your mouth. Rinsing with warm, lightly salted water usually starts on the second day after surgery. We recommend saltwater rinses at least 3 times per day. In some situations, the implant parts are not visible. However, the implant area should still be kept clean with gentle brushing and saltwater rinses. We recommend the universal use of long-term Paradex, chlorhexidine, brushing starting 2 weeks after implant surgery. Paradex is not meant to be used as a rinse. Typically, you will use this about every 3rd day with normal hygiene toothbrushing occurring 2 to 3 times per day otherwise. Smoking. We have found that smokers tend to do fairly well early on, but will often lose more bone quicker, which can result in the implant failing. There is also a slightly increased risk of early failure in smokers. Diet. The day of surgery, you should only consume liquids or very soft foods. It is usually best not to consume anything until 2 or 3 hours after surgery with general anesthesia. Pain medication and antibiotics, if needed, can be taken after a small amount of liquid or very soft food has been consumed. It is very important to maintain good nutrition for proper healing. Newly placed implants have a vulnerable time frame for a few weeks, so extensive chewing forces placed on the implant itself can result in implant failures. If you have had implants placed on one side of your mouth and the other side is normal, then we recommend chewing on the non-surgical side of your mouth until healing is complete. If you have a temporary crown placed on an implant, it should not be in the bite when we finish the procedure. Bone grafting. The most important thing to remember about the placement of bone graft material is that we want the bone graft material to stay in place. Excessive rinsing in the first 2 to 4 days after surgery could potentially displace the bone graft material, and use of the syringe to flush out a specific socket that has bone graft material in it would be contraindicated because it could flush out the graft material as well.